So this is on the lecture of enzyme, and we're going to look into enzyme kinetics, mechanism of action, regulation, and inhibition. However, it's going to be like a flip classroom whereby I cannot give the whole lecture for this enzyme within that time duration, and therefore I've already made it into a video, and hopefully just like a flip classroom require you to answer certain questions to build your understanding related to this lecture itself. The first part is going to be flip classroom, while the second part is where we will look into having lecture in the classroom. So this is the learning outcome related to this lecture, and it is likely that I will cover from the first bullet up to the fourth bullet in terms of irreversible inhibition by using flip classroom, as I explained to you in the earlier slide. So the following three bullets will be covered by having physical classroom to save time. Now here in this slide, I gave you an overview about what is enzyme is all about, but it's not something that you are unfamiliar altogether. I'm sure in school days or pre-U, you already learned about enzyme. It's just a reinforcement. Basically, enzyme is a biological catalyst, and there are also a non-biological catalyst, for instance, inorganic catalyst. These are metals such as palladium, nickel, special metals that they put in the industry and then provide high temperatures, and it will able to convert substrate to product. It doesn't have specificity. Um, More than one reaction could be catalyzed by that way. And then you have enzyme can accelerate chemical reaction or biological reaction if we are, focusing on enzyme being protein related. And once it changes substrate to product, it remains unchanged. And normally they will just add very little enzyme. And if it's in the body, very little amount of enzyme is required to able to do the job of converting product or substrate or number of substrates to become a single product or a few products in the end. And then since it remains unchanged, therefore enzyme can be reused again and again. Doesn't matter in the cell or as they specify it as in vitro, outside of the cell. For application of industry, it's also possible. No need to worry about adding every time. There is also entrapment. They use to trap the enzyme, and therefore every time they can reuse it. Okay. And how does the enzyme function? It is able to, within the active site, to perform in a different, you can call it a shortcut, where it lowers activation energy and therefore quickly becoming transition state and becoming product. It is highly selective, and that's important because it allows regulation in the body of regulating the enzyme, and therefore biochemical pathway can be controlled by regulating specific enzymes. And catalytic activity can be altered. This is the one alteration could be done by uh, inhibiting or activating, and this basically controls the particular enzyme. And when you control a key regulatory enzyme, it controls the metabolic pathway altogether. We will cover in terms of this alteration, the positively and also negatively, either by covalent modification or allosteric regulation, and also by poisons or drug in the later part of this lecture itself. Right? We are looking at enzyme being used in the clinical approach or clinical application, basically for medicine. So, for possible use of enzyme, one is for diagnostic indicator or diagnostic markers. This is where when plasma or blood, it has changes where certain biomarkers get elevated. It indicates there is disease, therefore can look into giving treatment or looking into prevention to the patient. So this is enzymes that has gone increase in quantity. Normally, it's increase in quantity. There are many enzymes. Let me give you the abbreviation of certain enzymes such as ALT, ASP, GGT, uh, CK, like creatinine kinase. All are biomarkers that is useful in diagnostic tests done on the patient, and then looking at the results, the test results, and looking into what need to be done, either for prevention or treatment towards the patient by the doctor. So that's diagnose disease or diagnostic indicator where enzymes are useful. Then we also have enzymes can be used to treat diseases. And this one is given example of TPA, tissue plasminogen activator, whereby when heart attack, it's possible to immediately apply this TPA, and it will cause dissolution of blood clot, and therefore can't it won't allow heart attack or blocking of the arteries in the heart altogether, and therefore can save the patient. As opposed to diagnose disease or diagnostic indicator or biomarker using enzyme, there's also enzyme being used in order to become kits, or as they call point of care test kits, or like example glucometer, where you can test elevation of glucose by just pricking the finger, and the strip will have glucose oxidase enzyme, where it will be monitoring the production of hydrogen peroxide after glucose react with this glucose oxidase. So that one, it's using enzyme put into making into kits. There are several useful enzyme that is already made into test kits, and one very popular example is of course glucometer. The last one is prognostic enzymes, like monitoring when the patient come into the hospital, whether they are getting worse or getting better. One example given here is lactate dehydrogenase, where it's a useful clinical enzyme. For example, for cancer patient, when there is high levels of lactic dehydrogenase, it's an indicator the cells, the cancer cells or tumor cells are dividing in actively. Therefore, must look into going into chemotherapy to reduce this indicator lactic dehydrogenase, and that's how to monitor and do treatment. Just to give you an impression about the general enzyme structure by using lysozyme. Lysozyme, the what is found in the cell to destroy outside invaders by having enzymes in lysozyme. So The enzyme lysozyme has been described to have a big structure with very big molecular weight. There are many parts which are actually not useful. Only the useful part is the active site, this part here, and that's where the substrate will come and bind and perform certain physical changes. And there is an attraction between the substrate and the active site. Has been mentioned there. You can see the difference between the active site, only 10 to 15 amino acid residues in comparison to the whole enzyme beyond 1000 amino acids. So this is a bit of understanding about apoenzyme, hello enzyme. Uh, Apoenzyme is basically just this whole structure which is protein related. Then you have the non-protein component. So when the the coenzyme, the non-protein compound, will bind into the apoenzyme, it will be then referred as holoenzyme. And the holoenzyme, having the coenzyme and the apoenzyme, will then be functional as an enzyme, as a whole enzyme. And therefore, the coenzyme can receive the substrate and cause a reaction to take place to then become product. So that's the difference has been referred here. Holoenzyme is a combination of apoenzyme and also if you put as cofactor, cofactor can be prosthetic group, can be coenzyme, and this example it's been referred as prosthetic group. I'll again make you understand what's the meaning of prosthetic group in a while. To understand what is cofactor, cofactor is like the big name, and then underneath there is coenzyme and also prosthetic group. Here, given alcohol dehydrogenase, alcohol can be broken down by this enzyme to become acetaldehyde, for instance. So this enzyme will seem to have two cofactors. One is can be said as the uh, zinc atom, which is already useful in binding the ethanol. And zinc is like the prosthetic group, permanently bond with the enzyme itself. Then comes another cofactor, which can be referred more accurately as coenzyme, which is NAD. When the reaction is taking place, ethanol is now at the active site. NAD will come and then will get reduced to NADH. And at the same time, ethanol will undergo reaction. And NADH will leave the active site. So that's the uh, difference between zinc atom. Zinc atom stays put in the active site of the enzyme, while NAD as a coenzyme will then leave. And also mentioned here, NAD is made of vitamin niacin, which is vitamin B. And normally coenzymes are requiring vitamin B to be produced. Assume you have already been exposed to enzyme, and this is certain terminologies related to enzyme. Enzyme, of course, the one that biological catalyst that converts certain specific its own substrate that is specific to it to become product. And then you have substrate also specific to each biological catalyst, and cofactor, just like just now, certain enzyme, not all enzyme, will have non-protein portion in their active site, and that's called cofactor as a whole big definition. Within cofactor, you have coenzyme prosthetic group as well. And then you have active site, where even though the enzyme is quite large, There's only small portion actually involved as active site. Of course, product you already know. The end result after substrate react with the active site of the enzyme. Here, as I said, its cofactor has a whole meaning towards the non-protein part of the enzyme. Then can break down to metal ions. This could be magnesium as an example. And then you also have coenzyme, which further can be divided as co-substrate and also prosthetic group. The prosthetic group is example given is FAD, while the coenzyme can be NAD, which during reaction comes and then reacted to become NADH and then leaves the enzyme. But the prosthetic group stays put for longer, the whole duration, and also wait for the next reaction. And also here, given the prosthetic group, how it looks like, the FAD and coenzyme once the reaction is completed, it detaches. It basically gives you an idea there are enzyme with no non-protein. But there's also enzymes having protein and non-protein portion coming together to function as an enzyme. So holoenzyme is actually made up of the apoenzyme, the protein part, and also non-protein part, which is the cofactor. And this cofactor can be prosthetic group or coenzyme. So this one stays tightly bound while this one loosely bound, therefore it can come out after the reaction. So that's what this slide is giving you an idea how are they separated as simple and also complex enzyme. You are familiar with enzyme will know they have specificity, they have uh, varying degree of specificity has been put in the table here, and they could be single substrate, which is absolute. For instance, urease only can recognize urea. If it become methyl urea, just adding methyl, no, it is only for urea. It will not recognize methyl urea. And then group of similar substrate, this one group, for instance, hexokinase, it sees any exosus sugar like as glucose, galactose, mannose, it will actually cause adding phosphate to it. It doesn't matter glucose or fructose or mannose, hexokinase seem to just add phosphate. So that's do not have high specificity. Then a particular type of bond, for instance, linkages, chymotrypsin, it looks at peptide bond, uh, doesn't matter which protein, where whatever protein, it start to cleave it and break it up. So that's the particular type of bond. As long as peptide bond, it will do the job. So what does enzyme do within its active site once the substrate come? It is able to cause reaction between the enzyme and substrate, whereby it uses a lower activation energy, as been shown here, compared to without enzyme, it is having a higher activation energy that need to be overcome. But with enzyme, due to the active site, facilitating the change from substrate to product and in between enzyme substrate, it will then cause lowering of activation energy. So please do not get confused between activation energy and this Gibbs free energy. Gibbs free energy basically describes whether it is hexagonic or endogonic for the reaction. But activation energy is the one relevant for enzyme. This is just to make you understand better about what enzyme does. If without enzyme, you can just have an idea that you have to roll the ball over a much higher hill compared to with the enzyme, where the burden or the challenges are much easier to overcome. Therefore, the lactose under lactase will be converted to get glucose and galactose much easier than just applying energy for them to vibrate and then break down to glucose and galactose. This slide basically gives you an idea that enzymes, certain enzymes, have binding activity site and also catalytic site. And catalytic site obviously found in all enzyme. The binding activity site or modulatory side or regulatory side is only on certain enzyme, and it's useful for controlling the catalytic site once some compound or constituent bind to the binding activity site. And it actually influences the catalytic site or active site once there is a binding. You are familiar with the specificity of enzyme substrate explained by using firstly by lock and key hypothesis, which initially came out, and then after that came out with the induced feed hypothesis. The lock and key is straightforward, is basically referring to the shape of the active site. If it has a similar shape to that of substrate, then it will accept the substrate at the active site, and then changes could take place to become product. And here, the shape looks very much to what the shape of substrate, therefore it can go in and proceed to become product. So the shape determines specificity. And yeah, this one is on the induced fit hypothesis. For some time, they realized a certain enzyme, though the shape does not, as you can see, the shape does not have similar shape to that of the substrate, yet it is able to be converting the substrate to product, and therefore difficult to explain by using the lock and key. So they came up with another hypothesis which applies to any enzyme that will undergo conformational changes in its active site once the substrate or its substrate come close to it. Then it will then able to undergo changes. So this is to explain certain enzyme that has conformational changes when it approaches the substrate itself. We move our attention on the enzyme kinetics, the understanding in terms of measuring how fast the constant of Km, the velocity, and to start off, we first understand the reaction itself, where it has reversible and also irreversible uh, part of its total reaction. So it starts with enzyme substrate, and then a reversible uh, uh, connection takes place between enzyme substrate, and then also another reversible connection where the reaction takes place in the active site, which leads to a combination of enzyme substrate becoming enzyme product. So from here to here, it is all reversible. But once it become a complex of enzyme product, that's it. It cannot reverse the process. It only can go forward, and it's quite rapid. It's very fast to become enzyme and product. So these whole reversible and irreversible reactions, from starting from enzyme uh, reacting or finding the substrate up to enzyme becoming product, can actually be explained mathematically, and that's what they call it enzyme kinetics. Slide basically gives you an idea about uh, an enzyme having active site, and it has two substrates, substrate A and B, already attached to the active site. and it will go through transitional step and become a product. But at the moment, it's showing the substrates binding at the active site. These are the two people or scientists that actually come up with this Michaelis-Menten in honor of their name on the enzyme kinetics. They did a lot of mathematical derivatization and finally come with the Michaelis-Menten equation. So they looked into actually these constants. There are several constants, K1, K2, K minus 1, which explains about enzyme binding to the substrate and become enzyme substrate complex and finally become enzyme and also product. Using this, they finally derive the Michaelis-Menten equation. It's quite uh, complex to derive and also prove it, but they have finally done it. So this is the Michaelis-Menten equation. And as you can see, the initial velocity is equivalent to Vmax multiplied by the substrate concentration divided by its constant, the Michaelis constant added with substrate concentration. A lot of effort was done to actually derive this equation and also to prove it that it is accurate. But it only applies to any enzyme that is not controlled allosterically. So allosteric enzyme does not follow this equation. And there is a few slides to come. You can see the Lin-Weaver or the graph that is substrate over velocity will have difference when it comes to those that apply to Michaelis-Menten equation and those which are allosteric enzyme uh, driven enzyme. Here, when it comes to enzyme kinetics, these are some of the terminologies that you should know and probably already know. Velocity basically looks into the number of substrate molecule converted to product and per unit time. And then the one that is used, they call it initial velocity, VO. And how much the unit is micromolar per minute. So within 1 minute, how much of product or substrate has been converted to product within in 1 minute. So if the one enzyme has higher number of velocity, that means the rate is higher. Okay. Km, of course, it describes how likely the substrate will bind to that particular enzyme. If the Km is lower, I repeat, if it's lower, then more likely that enzyme likes the substrate. Affinity is higher. But if the Km is higher, if you compare two enzymes, the one that has lower Km will have more likely to like the substrate or got more higher affinity for that substrate rather than the enzyme having higher Km. Okay. Vmax, has been described here, is the reaction rate when the enzyme is fully saturated by substrate. So when it's fully saturated, when it's fully saturated, that is the Vmax. We will see in slides to come about the graph. Quite a bit of information is given here. On this area here is actually the calculation when Vmax, the velocity is equivalent to half Vmax. And then when you put into this Michaelis-Menten equation, when you work it out, finally you'll realize that when it is uh, half Vmax, the Km is actually equal to substrate. That means based on this graph of hyperbolic graph, uh, the y axis being the velocity, initial velocity, and then the x axis is the substrate concentration. You will see the half Vmax at this area here. Once you extrapolate, that's where the Km is. The problem with this graph or this hyperbolic graph of V versus substrate concentration is where to put the asymptote, this line, where to draw it. Is it to draw here, or is it to bring it closer to the hyperbolic line, or even further up? So it's a bit of estimate that is not very accurate. That's why they shift to Lin-Weaver graph, which will give an accurate Km calculation. So this is after you put the uh, half Vmax, you will then understand that Km is actually at the equals to substrate concentration at velocity of initial velocity. And then what does the Km value signify? It is a constant that defines when the Km is lower, better it is when it comes to affinity for that particular substrate. When the Km is high, it doesn't like the substrate that easily, doesn't bind to the substrate, and therefore cannot convert the substrate to product. That's what referred here in green. Some other information also given in this graph, where the straight line, almost straight line here, is the first order kinetic. That means lots of enzymes are available to meet the substrate. And then here start to have competition, while here it's already saturated. All the enzyme already fill up with substrate. Therefore, it's also known as zero order kinetics here. So here, given the comparison between an enzyme meeting its substrate without allosteric regulation, and another enzyme that has allosteric regulation or modification. Okay, I hope you understand what is allosteric modification, where the inhibitor or effector or activator binds to a site close to the active site and then causes conformational change to the active site. So based on that, you will see the enzyme kinetics for something that does not have allosteric modification or allosteric regulation site. It is giving a hyperbolic graph. While the one that has allosteric regulation or modification, this is the structure or the graph profile will be. It is sigmoidal, so it doesn't apply with the enzyme kinetics of a normal enzyme that is not controlled allosterically. So if you see this kind of profile, you know it is having allosteric activation or inhibition. Since using that the hyperbolic graph is not very accurate, except especially for the asymptote drawing, and then taking into account half Vmax to calculate the Km, they actually decided to use the Lin-Weaver plot, which is more accurate in calculating the Km value, because this one, of course, you have to invert it, uh, initial velocity inverted to build the graph, being the y-axis, and then the x-axis invert the substrate, and then you build the graph. It is easier to calculate the Vmax because the y-intercept is actually 1 over Vmax, and then you get the Vmax accurately. Similarly, the x-axis or intercept is the minus 1 over Km. and then you can easily calculate the Km after getting the value of the intercept here. So Lin-Weaver work plot is much more accurate, except there's a limitation here. It's not accurate owing to the magnification of error corresponding to low substrate concentration. Because when you have uh, you know, 0.0 something of substrate concentration, when you convert it or invert it, it will become such a large number value. So it is not accurate based on this limitation. Other than that, it is very accurate in calculating Km and Vmax value. Right. Now that we cleared the understanding about enzyme kinetics and also the basics about enzyme, we move on into what actually affect the enzyme activity. And here given five parameters that actually affect enzyme activity. We focus on the first three, that is the substrate or enzyme concentration, temperature, as well as pH. So when it comes to substrate concentration, it actually start to become more better velocity or reaction rate will increase as you start to increase substrate, as been shown here. When you increase more substrate, the initial velocity will increase. But over some addition of substrate concentration, there will come a point where all the enzyme, as shown here, because there's a lot of substrate, is already saturated and there is no more left enzyme to pick up additional substrate added. So that's where it is starting to plateau. The graph start to plateau, and even addition of any more substrate will not cause it to increase. Of course, it will increase if you add more enzyme, but has been put here without with constant enzyme concentration. It is This is the hyperbolic graph that you get. Initially, as you put substrate, it will increase linearly, and then as the active site of the enzymes get saturated, more and substrate addition will not make a difference, and it will start to plateau the graph. Therefore, you get at the end result a hyperbolic graph. The next one is the factor that actually affects enzyme activity is temperature. Temperature, as you know, humans have 37 degrees, 37.4, 37.6 degrees Celsius as their body temperature. So that will be the optimum temperature for all enzyme to work maximum. Okay. But if you are capable to actually start the temperature from lower and then increase every time 10 degrees Celsius, you will see every 10 degrees Celsius is also known as Q10, has been referred here. The Q10, it will every increase by 10 degrees Celsius, it will become twofold or threefold in terms of the reaction rate. But as you approach close to the 40 or 37 degrees Celsius, beyond that, what happens is denaturation takes place for the active site, and therefore there will be a loss of activity. Even if you increase any further, it doesn't make any difference, and you could have a permanent loss of activity for the enzyme. Factor that actually influence enzyme activity is pH. There is optimum pH, and looks like for humans there are different organs and with different pH optimum. For instance, stomach, you have the optimum pH for pepsin to be around 2, so that's quite a low pH. And then you go to other area of the body. For instance, the small intestinal tract, there is trypsin, and trypsin has a pH of optimum pH of 8. And then you have a liver enzyme, arginase, works at very high optimum pH of 10. So Within the same body, there are different optimum pH where it works best for that particular enzyme. How to explain is the active site will have different amino acid for these enzymes, and the pH decides or makes an influence in how substrate will bind. So, for instance, say the active site of an enzyme is positive, it's positively charged because of the amino acid, creating positive charge, and the substrate is negatively charged, so they bind. But if you change the pH from away from its optimum pH, it is possible what was positive charge for the active site will become negatively charged, and therefore the substrate which is negatively charged does not come and bind to it anymore. Instead, repulsion can take place. So that's how it works when it comes to usefulness of the pH. Right. This one is about the cofactor. So we talk about the cofactor as well. Cofactor has underneath it to be coenzyme prostatic group. So here you can see, we look at the bottom one, where now the substrate, these two substrate, this one has additional smaller molecule, and it fits very well into its active site. However, when a regulatory molecule binds to the regulatory site or modulatory site, it will cause a change, which initially it fits very well. There will be a contraction. Uh, so now you can see the shape does not fit this substrate. So that's the effect of cofactor, which binds here. This is actually to explain about allosteric modulation. When it comes to inhibitor, we already talked about cofactor. Uh, Now we talk about inhibitor. In a way, we can say inhibitor is also a type of cofactor, but it is not positive. It's more negative, and it causes the reaction rate to slow down or completely shut down. When it comes to completely shut down, we call these inhibitors as irreversible, where it binds and then destroys the active site, therefore the whole enzyme itself. Looks like based on that, it can be divided to be suicide inhibitor, probably because of its own doing, or time-dependent inhibitor. This could be drugs or poison that causes irreversible harm to the enzyme. There are some examples in the slides to come. And then reversible, you can break it down to competitive, uncompetitive, and non-competitive. I think in school or pre-U, you were quite familiar with competitive and non-competitive, but now also you'll be introduced to uncompetitive for some of you. Let's look at all this competitive inhibition, non-competitive inhibition, which falls under reversible, and also we will look into irreversible type of inhibitors in detail. We use these structures and also the kinetics to explain about the competitive inhibitor. So when it comes to the structures of the enzyme, this competitive inhibitor, the enzyme and then active site, it can do two things. It competes. It competes with substrate, then if it binds to substrate, therefore it start to make product. And that's been explained in this direction. Enzyme meets substrate, become enzyme substrate complex, then become enzyme product. So good. But if the competition favors the inhibitor to bind, as been shown here, inhibitor binds, substrate now cannot bind to the active site. So what happens is enzyme inhibitor complex will form, and after some time, the inhibitor gets detached. Enzyme will then again bind with substrate and become enzyme substrate and goes this way. So it depends on who gets the active site of the enzyme. If it's substrate, then go this way. If it is inhibitor, then go this direction. Okay. So there is a natural competition, and you can overcome the competition of the inhibitor by simply increasing substrate concentration. When you increase substrate concentration, there's more substrate and less of the inhibitor. Therefore, substrate overcomes the inhibitor competition. Examples of this kind of competitive inhibitors include AZT. This one, from my understanding, is related to HIV enzyme that can use this drug as a competitive inhibitor and therefore as a therapy for HIV. Okay. You also have antibacterial sulfonamides, antimicrobial or antibiotics, and also chemotherapy using methotrexate. So, shown here, malonate. Malonate is a competitive inhibitor that is actually found in electron transport chain. It is able to compete with complex 2. Complex 2 got succinate dehydrogenase. Let's not dwell so much on that yet. When we go to the lecture of ETS or electron transport chain, we will revisit that again. Nevertheless, it is a competitive inhibitor as shown here. Succinate will be converted to fumarate if succinate bind to the succinate dehydrogenase. However, when malonate bind, there will be no reaction, but it is reversible. Therefore, again, it will come out and succinate can therefore bind to succinate dehydrogenase. So that's how it works in terms of competitive inhibitor with malonate as an example. The example given is statins. Statins are useful drug for those patients that have a high cholesterol. When high cholesterol takes place, we could look into intervention for the patient to be more careful in what food they consume, or we could also give drugs, statin, that inhibits this crucial enzyme that involved in making cholesterol in the body itself. So this is the pathway which involve acetyl coenzyme A, and then finally will lead to formation of cholesterol. So if we can inhibit this enzyme, therefore less cholesterol will be formed, and it therefore will not be deposited in the arteries, especially the arteries related to heart. Over the years, it will start to accumulate until there is a plaque or arteriosclerosis form. And once it ruptures, it will cause coagulation of the artery, and therefore nutrient and also oxygen cannot go to the site uh, after the block. And that's where it will lead to myocardial infarction or heart attack. Another example given that is ACE inhibitor that is related to blood pressure, but I'm not going to detail it out. We'll have to leave you some room to figure out this slide. So I'm just going to end at that. You try to figure out what is being described in this slide. This table shows the number of example for competitive inhibition done on crucial enzymes such as the statins, atorvastatin, which is Lipitor, uh, or simvastatin, and it inhibits the HMG-CoA reductase. So therefore, reducing cholesterol at times is also anti-hyperlipidemic agent. Can also bring down triglyceride. It doesn't have only a single purpose. Then allopurinol, it's the inhibitor of xanthine oxidase, therefore bring down uric acid, avoiding gout. And the others like captopril, ACE inhibitor, so can control blood pressure. So there are many examples of use of drugs that is able to inhibit crucial enzymes in our body. So After going through competitive inhibitor, now we look into what's the meaning of uncompetitive inhibitor and also non-competitive inhibitor. The uncompetitive inhibitor, bit difficult to explain and also bit difficult to understand, but here goes. What happens in a normal route is enzyme substrate binds to the active site, become a complex of enzyme substrate, and then it'll break down to enzyme and product once the reaction finish at the active site. However, in this uncompetitive inhibitor, what happens is when the enzyme substrate is really complex, that's when this inhibitor comes. So if you look at it, this is the enzyme, substrate binds here, and this gives an opportunity for this particular inhibitor to bind. And therefore, it now inhibits the whole complex of enzyme substrate inhibitor as shown here. So what's the outcome of such a inhibitor? If you build a Lin-Weaver graph, this is how it looks like without inhibitor. And then when added with inhibitor, it actually increase in terms of the 1 over V as well as negative 1 over Km. But when you convert it back to Vmax and Km, both will be decreased, even though it looks like it increased here. But when you convert it back to the value of Vmax and Km, it actually decreases. So the outcome of such an inhibitor is the Vmax and Km decreases. Example of such inhibitor is placental alkaline phosphatase. Uh, that is inhibition of this enzyme by phenylalanine. And the last type of reversible inhibitor is known as non-competitive inhibitor. And this inhibitor is quite simple. This one you already know, the enzyme substrate and then complex become enzyme product. However, for this, there is a regulatory site. The inhibitor binds to this regulatory site shown here, enzyme with inhibitor become enzyme inhibitor, and this is how it looks like in an enzyme inhibitor. There is allosteric side or modulatory side or regulatory side apart from the active site. And when the inhibitor binds at this site, it causes a conformational change, and therefore it either allows the binding of it if it's a positive effector, but since we are talking about inhibitor, the binding of the inhibitor will disallow the substrate to bind. Okay, so that is not good for the conversion of substrate to product. The example given is heavy metals such as argentum and also hydrogonium or uh, silver, and it combined with SH groups. Okay, and then also given other example, pepstatin and also soybean trypsin inhibitors. And also shown here two types. If the substrate binds here and then inhibitor comes next. But here, uh, inhibitor comes and then substrate comes. So there's two types. Non-competitive inhibitor can bind to the enzyme regardless of whether the substrate is already bound, while an uncompetitive inhibitor can only bind to the enzyme substrate complex, meaning it only binds once the substrate is already attached to the enzyme. So there's a difference between the uncompetitive inhibitor and this non-competitive inhibitor. This one can bind even when substrate is not bound to its active site. But the other one, uncompetitive inhibitor, needs to have the substrate bind first, then only the inhibitor binds. Okay, and one of the differences between non-competitive inhibitor and also competitive inhibitor, you cannot overcome its inhibition simply by increasing substrate concentration, unlike that of competitive inhibitor. So that's another crucial differences. Interestingly, we can do a comparison on the Lin-Weaver-Burke plot for all three types of inhibitors. So looking at it, the competitive inhibitor looks like the Vmax don't change because it goes through a single point even though you have inhibitor or no inhibitor. The blue is without inhibitor and the red one with inhibitor. The only changes could take place is the Km. Km actually increases, and that means the affinity towards the substrate reduces. Okay. And when it comes to the uncompetitive inhibition, as I already mentioned in its slide, both the Km and Vmax reduces because even though it looks like it increased, but when you invert it, it will become reduced. Okay. And while the last one, non-competitive inhibition, looks like Km is not affected. However, the Vmax reduces again because of the inversion. It looks like it increased, but actually the Vmax reduces. So these plots are a good area for setting questions. So you have to sort of understand and also remember them so that when you asked, you know which plot is meant for which type of inhibition. Completing the reversible inhibitor, there is also irreversible inhibitor which destroys the enzyme altogether. And on that aspect, there are cyanide, which found in bitter almond. While you see how the bitter almond looks like compared to sweet almond, in for me it looks like same anyway. So yeah, quite scary. The manufacturers who are scrupulous could do harm by mixing or entirely putting alternative almond in for the sweet almond. Okay. And then many others. You have also nerve gas, parathyron, penicillin as well, where it inhibits enzyme that builds cell wall in bacteria. So without the cell wall, bacteria is susceptible for antibiotic. This is on cyanide, which is a irreversible non-competitive inhibitor, whereby you can see it's found in bitter almond. In For me, it's just the color that different compared to the sweet almond, which is non-poisonous. The poisonous bitter almond has cyanide in it. Concentration-wise, I'm not sure how much you must eat in order to see the effect of cyanide. But cyanide has an effect to inhibit the cytochrome C oxidase, which is here in the electron transport chain. Uh, no worries, when we go for the lecture of electron transport chain, you will revisit all these complexes that is found in the mitochondria membrane. So what happens is cyanide prevents cell from using oxygen to make energy molecule, and therefore it causes aerobic glycolysis to become anaerobic, and therefore release of lactic acid can be very damaging. So that's the poisoning, and quite fast can lead to death. More examples on irreversible inhibitors, and this one is on snake venom. Snake venom has, I think this one is in viper venom, and it has this toxin that inhibits irreversibly enzyme of acetylcholinesterase. And due to the inhibition of this enzyme, certain neurotransmitters are affected, causing paralysis and also death, especially if the muscle is related to the respiratory tract, a respiratory mechanism, and therefore cannot breathe. Also have heavy metals such as mercury, cadmium. These are heavy metal ions that can irreversibly give rise to competitive inhibition, blocking a range of metabolic reaction. And lastly, antibiotic penicillin and vancomycin. These are antibiotics that can cause no production of bacterial cell wall, then therefore death of bacteria.